Today's debate on reducing the stigma associated with suicide is of grave importance to the constituents in my constituency of Sherwood Forest, particularly in Ollerton, which has one of the highest rates of suicide in the whole of the country. We know that suicide rate is 3 times higher for men than it is for women. And while there are many contributing factors to these, one of the most significant is the stigma associated with asking for help and speaking up about mental health. There are so many societal pressures on what men should be and how they should act. Often this involves appearing strong and like they can face any problem head on and by themselves. And this starts very early. As a mother to a boy, the attitude towards boys is often that they have to be strong, they have to be tough, they have to face things head off, and that crying is a weakness. It is ingrained by society at a very, very young age. And as a mother, I'm consistently having to battle with these things. I believe that the stigma of suicide not only affects the person struggling, but the people around them. Often loved ones don't know they were struggling and are left feeling confused and heartbroken. There's a ricochet effect of suicide, especially on the family and friends left behind. And I know this because our family lost someone to suicide. The act of suicide itself leaves you grieving for a life gone too soon, leaves questions, anguish and guilt. It leaves a space that will never, ever be filled again. Mark was a son, he was a brother, and he was a friend. And therefore, today, I welcome the government's landmark new health strategy that will help to tackle men's health challenges. I want to take the opportunity today to highlight the incredible work of a Nottingham organisation in Sam's name, established after the death of Sam Fisher. Sam's friend, Richard McHugh, wanted to create a safe place for males, breaking the stigma of talking about their mental health and realising that they are not alone. Their peer support group helps members find strength from men that have previous experiences or are also suffering with mental health issues themselves. Through the power of conversation, friendship and support, men in Nottinghamshire are saving lives. I will never fail to be astonished at the ability of people who are experienced unimaginable pain to use that in the pursuit of making the world a better place for others. The organisation runs several groups in Nottinghamshire communities, including in Ambleside Community Centre in Ollerton, and have a partnership with our local fantastic football team, Ollerton Town Football Club. It is vitally important that we take this conversation directly to men and where they spend their time, and that, especially in my constituency, is at the football. But it's also about ensuring our communities are equipped with the necessary infrastructure to give help and support when it's needed. In Ollerton, access to healthcare is poor. Given its rural nature and the high levels of deprivation, it is no stranger to the struggle to access basic services. Deprivation is a huge factor in suicide, with rates in areas of high deprivation being almost double that of areas with low levels. If we are going to reduce the stigma around mental health and suicide, people, no matter where they are born in the country, need to have access to healthcare and support. For Ollerton, this must include a super health centre, where people can walk in off the street and access healthcare they need. Working in collaboration with Ollerton Town Football Club, we want to transform lives, and that would work with a healthcare centre. I hope the Minister today will join me in recognising the importance of access to health services and support, ensuring men there are places to help and people willing to listen, not more so in Ollerton, that, as I said previously, has such a high rate of male suicide. And perhaps he would like to get on a train and come up to sunny Ollerton, visit the football club, and meet with Sam's name. You've obviously been to Ollerton before. And meet with Sam's name and see the fantastic work that they do, because I think the work that they do could be replicated across the country and have such a huge impact. But also for him to see an area such as Ollerton, which has fantastic people that like to support each other, but is suffering because they don't have the services nor the infrastructure to combat suicide. And that's what we need to save young lives. Thank you.